Most of us as senior surgeons actually trained by this, what we call health stadium principle. You see one operation, you do one, and then the next one you teach. But increasingly in recent years, this is becoming unacceptable by our profession. Next slide. In journals such as New England Journal of Medicine, as well as JAMA, surgical performance is becoming under increasing scrutiny by multiple stakeholders, patients, professional societies, government agencies, and healthcare payers. A lot of you may have read about Atu Gwandia's book, In Complications, as well as Better. So there are increasingly attention by most people on your surgeon's skills. Next slide. And you can see that in the headlines in BBC, New York Times, increasingly people are worried that surgeons who are not up to the mark, or not well trained, or not accredited properly may make more mistakes, doing harm to patients. Next slide. So there is an effort now by both professionally as well as governmental agency or accreditation agencies to have a systematic ways of, one, to train the surgeons, but also surgical skills. And therefore, I think this is one area where MedTech can come in. Next slide. So, and the ultimate aim, of course, is for patient safety and to improve surgical outcomes. Next slide. So this is actually very newly launched. You can see in July 2020. And this is a study on how to use simulation for training. And at the bottom left, you're looking at flexible ureteroscopy. There is a curriculum involving various types of either virtual reality simulation as well as a scope trainer in the middle area. But ultimately, in the top right hand, the trick for us physicians or clinicians is to see how we can ensure that using this simulation actually achieve improvements in clinical outcome as well as educational value. So this is a first randomized study that will happen in Europe. And I think this will spread widely to the States as well as our part of the world. Next slide. We have done some studies in this area, and we have found that flexible ureteroscopy do benefit from a training in training models. And Dr. Lu is the first author for this paper. But one thing I really want you to look at the photos on the right. These are 50,000 flexible ureteroscopes, and they were brand new at the beginning of the training. But if you look at the image, as they go through the work, and if they're not properly trained, the tendency is to damage the scopes. There is therefore interest by the companies, for the companies themselves, that if they provide a training models that are good, then the surgeons will be able to have their equipment last longer and last better. Next slide. Now there are new surgical procedures. One is this endoscopic enucleation of the prostate that we surgeons are developing models to train for. And this one is using turkey gizzards. Next slide. Another new procedure is en-bloc resection of bladder tumor. And here, again, one of my good friend, Jeremy Teo from Hong Kong, is trying to develop models to facilitate the training of new procedures. So urology, we are quite well known for developing new procedures. And there you have en-bloc resection of a bladder tumor, as well as the enucleation. But look at these models, they are very, organic, require animal parts, and just not pretty enough. So the core really is to have better models that is obvious, preferably not related to animal parts. And we will always need training models for new procedures. So it is a good idea if medtech companies are interested is to develop training models for new procedures. Next slide. And of course, robotic surgery is constantly evolving. And here we also developed a porcine model. But today I just had an email from guys in London of a training model that is not porcine based for robotic kidney transplantation. So robotic surgery is developing strongly, but it is complicated. And with the new robotic systems coming out, keep in mind that all these need training either models for the surgeons or training for the nurses to use the equipment. Next. So really, there is a need for training model systems. And as I've shown earlier, we are there to validate the outcome by research. And the aim is to improve patient outcomes. We want to be able to show that your training models can facilitate and improve patient outcomes. And I think this is coming. And there are more and more novel new procedures, and you will know of some of the prostate treatment procedures. And of course, these will need training. And these companies will be looking for medtech that can actually be incorporated into their training in a new equipment. And ideally need to be improved to move away from all the animal materials that I see. Next slide. So this is a company in Japan, and which works with one of my friends, and involves a partial nephrectomy kidney model. And it is a incorporated company in Japan. They sell this at about $200 each. And SGH as well as us and various training centers have used these to train in robotic or laparoscopic partial nephrectomy. And I think there's room for 3D printing such that people are able to rehearse a surgery for a complicated, complex kidney tumor if they want to. So right now, they are quite generic. The two yellow tumors are on the kidney, but potentially for complex tumors, they can 3D print the tumors so that you can practice your surgery before you actually do it on the patient. Next slide. And this is at Intuitive's base in San Francisco when we went there, and you can see in the picture on the top right hand, you can see that there is a very realistic model that they are building. The problem with this is that it takes about 3 weeks to build a training model. So there is a way to have synthetic tissue that is realistic, that can be done off a CT scan that is for a surgeon to practice. That will be ideal. And you can see in the middle there is a pump where they pump red dye in, and that's supposed to simulate blood when you're actually cutting to the tissue. So I think there's quite a lot of medtech interest for surgical training. Next. I just want to have a quick one on the surgical simulators, and for all people developing surgical simulators, ideally these need to be surgical specific. But one problem is they don't tend to provide accurate tactile feedback, and perhaps that will be the holy grail. And for these to be cost competitive, and for us, we'll be interested that when you incorporate into a training program, we can show improvement in outcomes of surgery. Next slide. Of course, we've tried Google Glass, which has gone out on fashion to use it in operating theater, but perhaps this is one area where HoloLens may come in, and Dr. Lu has spoken on that. Next slide. Oh, and this is just to say that's one of my colleague, Ben. He's also at Intuitive, and you can see that virtual reality may not just be used for training the surgeons in the surgery, but also think if you want to develop a training for robotic equipment, that this is to use for docking of the robot to the patient. So he's using virtual reality to drive the robot, to park it next to the patient. Next slide. So I think I'm concluding here, whereby just to highlight that medtech for surgical training, there may be commercialization opportunities for surgical equipment if some of these models can be enhanced training on new equipment, new operations, and certainly of interest to academic institutions, which may buy them to train their surgeons, and more professional accreditation bodies, such as East Asian Urological Surgical Training and Education Group, will be interested in using any training equipment that we can to better train our residents, train our doctors, moving away from animal parts.